Living with chronic pain can be a constant battle, right? Whether it's the stabbing pain that you feel in your heel when you get out of bed first thing in the morning, or maybe it's the ache in your shoulder that never seems to go away, or the stiffness in your knees that prohibits you from doing the things that you want to do. Everyday tasks start to become overwhelming and frustrating, and you wonder if you're ever going to be yourself again. Well, at our clinic, we pride ourselves on allowing people to get back to doing the things that they want to do. And we do that through combining physical therapy, chiropractic, and personal training, and functional medicine into this truly integrative approach. But recently, we've added Shockwave to our toolkit, and we're seeing amazing results in our clients' ability to achieve relief and regain their lives. It's something we're genuinely excited about because we've been watching Shockwave technology develop, and we've been reading study after study over the past decade for conditions like plantar fasciitis and various tendon problems and osteoarthritis and low back pain and shoulder rotator cuff problems and meniscus tears. And so finally we dove in and we brought Shockwave here to Sonora, and it's delivering way better results than even we expected. So in this video, I'm going to explain what Shockwave therapy is, how it works, and maybe most importantly, the clinical effectiveness of all this research that finally prompted us to finally go out and get Shockwave and bring it here to Sonora. So if you're frustrated with chronic pain and you're ready for a new approach, then this video is for you. So what is Shockwave therapy? Well, bear with me just for a little dry explanation first. Shockwave therapy is an FDA-approved, non-invasive treatment that uses acoustic waves to stimulate the body's natural healing ability, and these waves deliver high energy pulses into targeted tissues. So it works by sending powerful shock waves deep into the area of concern, followed by a negative pressure wave that causes microcavitations, which are basically tiny bubbles in the tissue. And then these bubbles implode, which creates a second wave of shock wave. So to achieve this, the Shockwave device uses an air compressor that accelerates a metal projectile inside the applicator head, and the applicator head is in contact with the patient's skin. Now, the kinetic energy from that projectile is converted into a high energy acoustic pressure wave, and this pressure wave moves through the tissue and exerts a mechanical force on the cells. Now, this mechanical stimulation causes biochemical reactions within the cell, and that is something called mechanotransduction. So this physical effect has two main outcomes. First of all, it relieves pain. But second of all, it signals the body in a controlled way, so it's sort of a controlled disruption of the tissue, to release growth factors and stimulate the body's natural healing ability. So you can think of Shockwave like little workouts, like strength training. When you do strength training, your body actually creates little micro tears in the tissue, and then what your body does is it senses that mechanical load, those little tears, and it brings in new healing tissue. And the result is that the body, like the muscles and the tendons, will gradually get stronger. They'll become more resilient. They'll have more capacity, not only with muscles, but also with bones and tendons and everything else. This is what happens when we work out. We increase the capacity of the tissue. Well, Shockwave therapy works in a similar way. It creates little minor disruptions in the tissue, which stimulates the healing process. So again, this whole process is called mechanotransduction. And if you've never heard of mechanotransduction, basically what it means is your body's ability to sense a mechanical load and then make the necessary appropriate adjustments to that load to make the body stronger. Now, Shockwave therapy works on multiple levels to promote healing and relieve pain. So we're just going to go through a few of them very briefly. First of all is it improves circulation. So not only improving blood flow, but also creating new blood vessels in the area. It stimulates this thing called angiogenesis, which Genesis, you can understand what that means, to make, and angio is blood vessels. So it starts this process of bringing new blood vessel growth to the area. And what does that do? Well, it brings more nutrients and more oxygen to the area to help it heal. Second of all, it triggers tissue repair, and it does so by activating fibroblasts and osteoblasts. Now, fibroblasts are cells in muscles and collagen, like tendons and ligaments and whatnot. Osteoblasts are cells within bone. It stimulates these tissues to rebuild these tissues, making them stronger and more resilient. The third way is it helps break up scar tissue. So Shockwave actually breaks down scar tissue and fibrosis and calcification that restricts mobility and causes pain. So it restores function with that. The fourth way is that it increases the natural healing factors. So basically, when it disrupts the tissue, those tissues release these growth factors. So you get growth factors being released, which stimulates those fibroblasts to come in and make new tissue. Now, the fifth way is simply pain relief. Shockwave desensitizes nerves and it disrupts the body's ability to transmit those pain signals to the brain. So it's really good at pain relief, while also, as I've mentioned in the previous four things, creating tissue regeneration and tissue healing. So you're going to get this cascade of pain relief combined with new tissue healing. So thanks to these combined effects, Shockwave is used widely around the world for a variety of orthopedic conditions, including rotator cuff problems and Achilles tendinopathy, plantar fasciitis, arthritis, low back pain, frozen shoulder, things that we're about to cover in this next section, clinical evidence. So no video would be complete without covering the actual evidence behind what we're about to talk about, right? So how powerful is this clinical evidence? Well, rather than cherry picking studies, what I'm going to do is outline something called meta-analyses. And what meta-analyses are studies where they take a broad look at all the other studies that have been done and they tally all the results together and come up with an answer that's based on all the previous research. So let's start with tendon pain. So this meta-analysis looked at 45 other studies on the effectiveness of Shockwave on various tendinopathies, including, by the way, tendinopathy is a fancy way of saying tendon pain, right? So these included Achilles tendinopathy, plantar fasciitis, tennis elbow, and rotator cuff tendinopathy. And they concluded this study suggests ESWT. Now, again, ESWT is the fancy way of saying shockwave therapy. It stands for extracorporeal shockwave therapy. So they say this study suggests that ESWT can be a highly effective therapy option for relieving pain in people with tendinopathy. All right, what about just knee tendinopathies? Well, this meta-analysis looked at 19 studies and concluded the results revealed significant moderate evidence of the safety and efficacy of general ESWT in increasing the treatment's success rate, reducing pain, enhancing patient-reported functional recovery, and improving performance-based functional outcomes in patients with knee soft tissue disorders, regardless of the follow-up duration, which means it lasts, shockwave type, application level, control intervention type, or treated population. All right, what about rotator cuff tendinopathy, you ask? Well, this meta-analysis looked at 16 other randomized controlled trials for shockwave application for rotator cuff tendinopathies, and they concluded extracorporeal shockwaves can also effectively loosen adhesion tissue and relieve soft tissue spasms, thereby increasing range of motion of the shoulder joint. These results offer the most robust current evidence regarding the utilization of ESWT in rotator cuff tears. ESWT can eliminate inflammatory factors in the patient's body, relieve pain, promote early recovery of the shoulder joint function, and improve the curative effect. All right, what about Achilles tendinopathy? This meta-analysis looked at 11 studies and concluded ESWT produces greater short-term and long-term improvements in pain and function compared with non-operative treatments including rest, footwear modification, anti-inflammatory medication, and gastrocnemius soleus stretching and strengthening, which basically means calf stretching and strengthening. Okay, so moving out of the tendinopathy area, let's move into osteoarthritis. This recent study on grade 4 knee arthritis, which is considered severe osteoarthritis, compared physical therapy alone to physical therapy combined with shockwave therapy. The results were really impressive. The group receiving shockwave therapy showed an 82% improvement in functional ability compared to just 48% in the physical therapy group alone. Now you may wonder, how is that? Well, again, it goes back to the mechanism by which shockwave works. So if we take a look at this very recent study on shockwave for degenerative meniscus tears, it shows that there's significant changes in the meniscus that you can actually observe on the MRI due to the use of shockwave. This study reported that ESWT improved the condition of the meniscus by reorganizing collagen and reducing swelling. And they also reported that patients felt significant pain relief in just 3 weeks after starting treatment. And they also said no serious side effects were reported and the treatment was well tolerated by all patients. Now, if you've ever had frozen shoulder or known somebody who has it, you understand what a serious, frustrating condition this is. It's characterized by lots of pain and really limited mobility, and it can last years. So this systematic review and meta-analysis evaluated various non-surgical treatments and identified shockwave therapy as one of the most effective options for reducing pain and improving shoulder function, basically range of motion, performing comparably to established treatments like ultrasound-guided capsular distension, which is when they use an ultrasound to guide a needle into the joint and inject high fluid in there to distend the joint. So Shockwave seems to be comparable with that procedure. So what about other treatments? How does Shockwave compare to other treatments? Well, this new meta-analysis compared Shockwave to corticosteroid injections for plantar fasciitis. And after looking at 16 studies and over 1,000 patients, they concluded that Shockwave was more effective at both 3 months and 6 months for relieving pain, improving foot function, and reducing plantar fascia thickness when compared to corticosteroid injections. And now you can start to see why we were so motivated to bring Shockwave to Sonora, right? So if you're suffering from chronic pain, whether it's plantar fasciitis or arthritis or rotator cuff tears or whatever, any of the things that we already mentioned, and there's other things that I didn't even mention, and if you're frustrated and you keep getting sort of like hitting the wall, dead ends, Shockwave therapy may be the treatment that you're looking for. It's already transformed the lives of many of our patients, and clearly many patients worldwide, and you can see by all these studies why. So if you've tried other therapies and maybe you've seen some improvement, maybe you haven't, but you're still searching for something that can really make a difference, Shockwave could be the missing thing that you're looking for. We're passionate about helping people reclaim their lives. We're passionate about helping people restore the things that they love to do in life. So if you're ready to try something new, something that's been proven to work, give us a call or book an appointment to experience Shockwave at our clinic. It might just be the game changer that you're looking for.